Hi, everyone, and thank you for joining us today. My name is Paul Adepoju, and I'm the community manager for the ICFJ's Pamela Howard Forum on Global Crisis Reporting. And today we are having a topic that used to be on everybody's lips when we started this series of webinars, and which is COVID-19 pandemic. I remember when the COVID-19 pandemic started and journalists from different parts of the world were here, including those that weren't even reporting science or health stories. Almost every scientist had to quickly adjust to the new reality of having to report this global pandemic to the general public. And looking back, a lot of stories have been published. The body of knowledge regarding this particular disease and several other diseases of public health importance has rapidly expanded, and the world is largely not the same again, considering the several issues connected to this pandemic continues to be relevant today. And one of such is this series of webinars. We started as emergency, as a quick option to improve journalist reporting skills, what has become almost a weekly affair now since the pandemic started, in which we bring information to journalists in different parts of the world regarding what they need to know, other crises and issues that we believe journalists should be reporting about, in addition to expanding the knowledge base of journalists regarding topical issues and helping journalists to improve their careers. We'll get back to the issue of improving careers later before the end of this concise and precise session. But what I just want to bring to your attention is what has been happening with COVID-19 pandemic. And if you recollect that when the COVID-19 pandemic was declared a public health emergency of international concern, a lot of efforts were mobilized globally to actually address this particular pandemic. And a number of deaths were reported, and it's been a very, very crazy, very serious couple of weeks already, and the pandemic is not yet over, but a lot of things had already happened. As at the last count, if you look, let me share my screen. At the last count, the number of deaths of COVID pandemic from the COVID-19 pandemic has actually exited nearly 7 million. So there have been about 7 million reported deaths of COVID-19 pandemic, although estimated number of deaths is projected to exceed over 31 million deaths. So almost an estimated more than 31 million people had already died from the COVID-19 pandemic, and over 770 million cases have been confirmed of this particular disease. And I'll be surprised if there is anyone in the audience listening to this session that throughout these years of the COVID-19 pandemic, that person did not actually test positive for COVID-19. I know I tested positive for COVID-19, not once, not twice, but 3 times. And it's no longer a disease that was reported or restricted to just one part of the world, but it's actually a disease that is truly global in nature. And so what we'll be looking at is what you need to know, how to improve your reporting skills on this disease, and how you can still continue to make your audience to be interested in this COVID-19 pandemic. And one of the tools that I always recommend is using data to actually follow your reports, to actually report your stories. And a good tool that I personally use for my for COVID reporting, not just to report stories, but also to keep track of what is happening vis-a-vis the pandemic, is our World in Data platform. Awarding data is has been very, very resourceful in bringing data regarding this pandemic to you in a nutshell. Within almost every data that you need, you can easily access it through this interface. And this has been an extensively consulted and referenced material. So depending on which part of the world you can actually keep track of these various metrics for regarding the outbreak. For instance, you can even download the data and analyze it your own way, but you can also look at their own curated reports regarding various key trends on the pandemic. So let's look at the number of tracking hospitalization. Unlike at the peak of the, I think the highest number of hospitalizations or recorded number of hospitalizations, as you can see, peaked in January 17, 2022. You can see the global landscape, but you can see that this data is actually skewed to a particular country, which is the US. And the US has, even though the US has, you can see most data coming from the US, but if you still look at it, you can still see some peaks from elsewhere, other parts of the world. If you look at this region of the data, you can actually see that within the same period, lots of cases were being reported across the world. But one of the things that I like doing is actually breaking it down. You can actually localize it depending on how much data your particular country is actually producing. Let's take Canada, for instance. You can still look at the trend of the disease in Canada, or you can, so let's say we put it in Canada, looking at the trend of how the pandemic has been, hospitalization, the number of people that have been hospitalized with COVID in Canada since the pandemic began. In a nutshell, you can actually see the data spread like this. And you would, around the same period too, it also peaked, hospitalization also peaked around the same period in January 25, 2022, before gradually coming down. It doesn't mean that why people are not reporting COVID again, it doesn't mean that people are not being hospitalized for COVID. As you can see in this data that you're looking at on your screen, at the moment, as at September, in September 2023, nearly 3,000 people are still hospitalized with COVID in Canada. So if you're a journalist in Canada or any part of the world and you're interested in writing a story, you can actually still do something regarding hospitalization in your country by looking at the available data. Let's say if you are not in Canada or you are in another country, let's say you are in Ireland, you can still see the number of people that are hospitalized in your country in Ireland. So in Ireland, as at September 10, we have 376 individuals that are hospitalized already, that are reported to be hospitalized for COVID. So COVID is still here and is still worth reporting. So you can, if you are trying to do a story at the moment, so this data can give you insight regarding hospitalization. That is hospitalization alone, and it varies from one region to another based on the available data. Another thing that you can work on as far as this outbreak is concerned, before I leave that, I think something that's a story idea that I hope somebody would work on is actually this peak. Identifying the peak. You know, a lot of story, many times we are looking at when journalists want to report stories, they focus on what is actually current at the moment, what is happening, music kinds of storytelling. But I believe and a potentially award-winning story idea that you can do is now go back and now laser focus on just a key section a key aspect of the outbreak. What am I trying to say? If you're in the US, if you're a reporter in the US, and we can actually see that a story that I would do anything to read right now is what happened on January 19, 2022. Imagine a really good feature story, January 19, 2022. What actually happened? Talk to experts, those that were actually involved, those that were actually hospitalized, and actually bring us back to this particular day that was the peak of the pandemic. What was the peak? And this is not just restricted to the US alone. What was the peak of the pandemic in your country? What information can you gather about what happened on this particular day in your country? What insights can we draw about what happened in your country on this day? Because COVID is no longer a public health emergency of international concern, and attention seems to be drawing elsewhere. Do you need to now go back, peel back, and start looking at scenarios, incidences, and key moments in the pandemic would really go a long way in providing some insights and helping us document this very important chapter in the history of humanity. So look back at your country, at your region, or at your city, for instance. For instance, we have parts of some countries that are actually documenting their that documented the outbreak region by region. So if you don't want to approach it through a national data perspective, if you are in a city, it would actually really make a lot of sense if you can look at the peak of the pandemic in your particular city at that particular moment. What happened on the day that your country or your city recorded its highest ever number of deaths? Look at this particular data that you are looking at. We are looking at the number of COVID-19 patients in intensive care units. Like I said earlier, still in the US, still in September, nearly 2,000 people are actually in ICU with COVID-19. Elsewhere, we still have people in ICU with COVID-19. But while that number is still high, you can still see that it was nothing compared to what happened at the peak of the pandemic on January 10, 2021, where in the US we had nearly 30,000 people in ICU for COVID. So this is a very key chapter in the pandemic that we seem to be, I believe the time is now right to peel it back, take us back to that key moment in history, tell us what happened, who are those that were actually the key players, who were the health workers that were on shift on this particular day, and what were the insights, what were the stories that we probably had already missed because we had to be reporting in real time. So if you want to be doing feature stories, if you want to be doing retrospective stories, this is a particular time that I believe that your audience would be really appreciative of a story that looks back at what happened. And yes, so that is something that I think you should do. That is one idea that I would like to share with you, going back in history, telling us what happened the day that you had the highest number of COVID-19 cases in your country or in your city. Then we also need to talk about vaccination is a big deal. At the moment, in spite of the fact that the COVID-19 pandemic is no longer a public health emergency of international concern, vaccination is also a major issue. And I will still use this data. If you look at this data, nearly more than 70% of the world population has already received at least one dose of a COVID-19 vaccine. And this is a monumental historic feat for the world to achieve, at least more than 70% of the world's population having received at least one dose. And then about more than 13 billion doses have been administered at an average. Currently, COVID-19 vaccination is still ongoing Nearly 30,000 doses have been administered every day. And in low-income countries, almost 33% of the people in low-income country have received at least one dose. So if you're a journalist, that is, what insights can you gain from this data alone? If you are looking at doing a story on equality, why is the proportion of the population in low-income countries that have received at least one dose much lower than the global estimate? So it's less than half. So that is a story that you can still work on, because we've been on this COVID-19 vaccine for years now. And if you remember the early days of the vaccination, you can actually remember that there was this chapter of vaccine inequity. We did a webinar on this vaccine inequity, and what were the driving forces behind. So a good story to do right now in the area of vaccination is to actually look at this vaccination trend and look at the fact that, okay, there are lots of doses to go, and now what are still the impediments, what are still the limitations to actually having this vaccine rolled out. And one of the things that many countries in the world are trying to do is to integrate COVID-19 vaccination into their national immunization programs. And especially in developing countries, many African countries are looking at integrating the COVID-19 vaccination into their routine immunization programs, especially considering since May that the World Health Organization said COVID was no longer a public health emergency of international concern. So a story you can write is how is this evolving in your country? I did something like that I wrote a piece on this issue that was published recently. And so let me see if I can share it. It looked at the COVID-19 vaccination landscape and how countries in Africa are now integrating this vaccine into their vaccination program. So yeah, this was a story that I said I wrote. My story focused on the African continent, Africa's post-pandemic vaccination landscape. It looked at how African countries are integrating their routine COVID-19 vaccination into their routine immunization programs. You can do something similar in your region. You can talk to you can talk to immunization officials in your area about the vaccination program. You can ask about what is the reality of this vaccination program, what has been lost since, what has been at the adoption rate, what is different in terms of the logistics, in terms of the systems in place during the public health emergency phase of the response, and now that a lot of other issues are now getting more attention than COVID. So that is looking at the post-pandemic phase of the vaccination in your region is actually a good story that is really, 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 really worth telling. And I really, really hope you take your time to actually tell these stories. And the data doesn't lie. Data, when properly curated, does not lie. And we've already seen a significant drop in COVID-19 vaccination, but in some countries, in some parts of the world, it was due to the fact that a lot of people had already gotten the vaccine. So for instance, if you look at daily COVID-19 vaccine doses administered, so if you look at this trend, globally, in June 2021, the world was administering nearly 44 million doses every day. On this particular day, over 41 million doses of the vaccine were administered. But if you look at the present day, the world has gone from over 47 million doses, nearly 44 million doses daily, to less than 30,000 doses daily. So you can see that it's not just something that is peculiar to one part of the world or another. There has been a significant drop in COVID-19 vaccination administration. In some places, I know some places that have vaccination rate of more than 90%, but this is not the case globally. So figure out what is the vaccination rate in your region, not just country. You can look at your city. You can the well-written stories, the best stories are not just stories that look at national estimates, but they are stories that focus on a particular region and actually zeroes in and tells that story from the local perspective. So even if it's just your street, what insights can you get regarding vaccination rates in your region, on your street, in your local government, and that could be of global relevance. So those are the kinds of questions that I really believe we need answers to at the moment, that people will be fascinated to read about. So that is a kind of story that I will also recommend that you read. What is another story that is worth working on has to do with the factors that prevented people from actually getting vaccinated. We talked about we cannot underestimate, we cannot overemphasize the challenge posed by misinformation. And a lot of people said they will not get the vaccine because of one form of misinformation or the other. So a good story you can do is, we have people that are actually very, very vocal about their dissatisfaction or their decision not to actually receive the vaccine. So you can cut a follow-up story, find one or two of them that you can talk to, telling you their stories, their experience, and how this has evolved so far, so that we can have an update on the current state of vaccine misinformation vis-a-vis the COVID-19 pandemic. And these are really good stories that the time is really, really right for you to actually talk about. Then something that I also want to bring attention to is the issue of policy changes. We had the introduction of so many policies were introduced as a result of during the COVID-19 pandemic. So many sweeping policies were introduced by governments across the world regarding the COVID-19 pandemic. Countries introduced travel restrictions initially. These traffic restrictions were changed eventually. We also had face covering mask. We also had lockdowns. We had lots of policy changes during the COVID-19 pandemic. So a good story that you can also still work on is keeping track of getting insight on this particular policies, how they evolved, what are the current state of these policies, which policies were effective, which policies did not provide significant results. So what are the lessons that policymakers had already learned regarding how to effectively control a pandemic. So this is a really good aspect of a really good story that I strongly believe that is also worth telling. So talking of the present day, if you are looking for stories that only focuses on what is happening right now, there are lots of opportunities for that, and a lot of stories are actually evolving in real time, that if you are trying to catch up with what is happening, then I would recommend still give you some suggestions. For instance, something is happening this week that has already started, which is the UN General Assembly. The UN General Assembly has already kicked off. At least we are seeing events, we are seeing posts on social media regarding this particular event, and a lot of world leaders are attending, making presentations, making pledges, and on various issues, and health is one of such. And COVID-19 is one of the topics that they are discussing. And so I would encourage you you to keep track of what is being discussed regarding COVID-19 at this particular assembly. So okay, yes, I was looking for the saved link that I saved. So if you go on the WHO's COVID-19 page, you can see overview, prevention, symptoms, and all of that. But if you scroll down, you can see news on what is happening. The most recent being unprecedented focus on global public health at UN General Assembly. So even if you are if you are covering international politics, international global relations, this could be something to keep your eye on regarding how the COVID-19 pandemic has impacted or not, impacted or not impacted deliberations at the UN General Assembly. Because every now and then I saw a post by the DG of WHO on Twitter, Dr. Tedros, and Dr. Tedros, WHO's DG, and several other public health stakeholders are often trying to say that COVID-19 has been a rallying point on why countries need to prioritize investing in health. And how is this evolving? What are people saying regarding what is happening that could be of global health relevance at the UN General Assembly? So it's not just about a political leader making any promise. It's not just about discussions around Russia or Ukraine. There are also expected to be interesting conversations on global health. So that is something that you can focus on when you are covering these global events like the UN General Assembly. So that is one of the issues that I think you should be able to cover. And you can ask me, how do you keep track of this? In addition to that, so aside from the UN General Assembly, you should always be on the lookout tracking conversations around COVID-19, especially as it affects you. For instance, just go on Twitter. Twitter is even though it is what it is right now, we can still do some things on Twitter. So if you go on Twitter and you just search for COVID, this is a search that I did on COVID. You will be able to look at what people are saying, but a major issue that I should be concerned about is misinformation. Social media has continued to be a rallying point for misinformers. I'm not saying you should use this as your only source. I'm just saying sometimes some people can be talking about issues that could be relevant to your story that you are not actually tracking yourself. So when you go to Twitter and you just search for COVID, and so I believe that you'll be able to get some insights regarding this. For instance, one of the posts talked about the impact that the COVID-19 pandemic has had on other vaccination programs. Whether, for instance, if you saw the misinformation, the discouragement of people from receiving the vaccination during the COVID-19 pandemic, it was severe. So now peeling back to, you can do stories on what impact that particular phase of the pandemic has had on other vaccination programs in a lot of African countries and other parts of the world that struggled with vaccine-derived poliomyelitis. The goal remains expanding access to zero-dose children. Zero-dose children are children that have not received any vaccination dose. So that is a major goal. So we can start asking questions regarding how is the adoption of this vaccination actually evolving. I did a story on that too a couple of months ago, and it's something that you should also explore. So peeling back and looking at the effect that key issues, key aspects of the COVID-19 pandemic, especially the acute phase, had the long-term effect that it has had on present day issues. So Twitter is a really good way for you to know what people are talking about. And of course, you can talk about, you can track policies policy changes that people are doing. So that countries are introducing and what countries are not introducing. You can actually have that conversation. But like I said, depending, the algorithm of Twitter is really, really crazy right now. So it's better you just be careful on how you use it as a reliable source. Instead, make sure you are compliment. Just keep an eye on what the conversation is and not just relying on what you are seeing online, but actually going out there, like you would have noticed in a lot of recommendations that I've made so far, is about how you can actually keep track, talking to the right people. Talking to the right people, you should also be able to track what international organizations, those that were actively involved with COVID, what they are actually doing. And one of such is the issue. There are some notable international organizations that were actively involved. And so these organizations are also worth keeping track of. A good example is Gavi, the Vaccine Alliance. So this is Gavi, the Vaccine Alliance's page, and it's involved in a lot of vaccination programs, but there is a shortcut if you want to know what it's doing about COVID. So just click the COVID, so this icon here. So just click the COVID icon there and you can actually have an update, know what is happening, and so just gain general insights on the kinds of conversations that are very much relevant to this organization and what they are talking about. If there is a new policy, if there is a new development around these issues, these are the kinds of organizations that would be the ones to actually provide more insights on how to do it. But there's also another angle to this that I think is really important. During the COVID-19 pandemic, especially the acute phase, one of the major impacts that the pandemic had on global health in general was its negative influence on other public health issues. What am I trying to say? Some countries had to prioritize their COVID response over other health issues. Some vaccination programs were suspended, some initiatives were just abandoned so that the country could be laser focused on closing its wide COVID-19 gaps. So it's really important to also try to do stories on how countries are adjusting to this, what the lessons they've learned is, and such international organizations too, like Gavi also, there was a time during the COVID-19 pandemic, there was a time it suspended its support for some it suspended its interest in supporting some vaccination programs. But with the COVID-19 no longer, so one thing you can do is specifically know which issues that were directly affected by this pandemic so that you can now do a catch-up on what is happening. Are those issues that were directly impacted now enjoying respite? Are things now going as they should be? The programs that were suspended, are they now getting attention that they didn't enjoy the last time? So that is something that I would actually recommend that you also check out. And talking of strains, we continue to hear strains. A lot. And if you would agree with me, there was a chapter in the COVID-19 pandemic response that the headlines were just like new strains identified, these strains of the COVID. Journalists were fixated on reporting these new strains, which is totally understandable because it's an update that is worth sharing and could actually have potential impact on let's say, the efficacy of the vaccines, and of course diagnosis and other response and other key aspects of the disease. But between then and now, we've had new strains. So something that you can do is to also keep track of these new strains. You can find out how many strains so far have been reported in your country. Is your country, and the way the strains are identified is through a scientific process called gene sequencing. So you can ask, is your country still conducting sequences? How many sequences has your country produced so far? So if sometimes you can find yourself discovering that your country probably has not produced any sequence in a long while. So that is a story worth telling. So the story will be, what are the implications of this decision not to actually be proactive regarding publishing new sequences. So that is a story that is worth telling. Talk to experts on what is happening. If you can figure out why your country has not been doing it, or why no, we are not having updated information about the new strains, the geographic spread of the new strains, then it's something that I think it is also worth reporting. And talking of other issues that I think you can also work on, I always look at disease response, not just in isolation, but as a constellation and connection with other issues. So what are the other issues that, for instance, there was in the middle of the pandemic, I think during the acute phase, we had issues regarding women's health, women empowerment, protection of women to abuse. So how has that evolved? So what insights look at? You can talk to advocacy groups. How did they handle it? So, like I said, you can do peeled back storytelling, or you can actually adapt it to the present day, so that we are looking at what is still happening today, not just in connection with the COVID, but what did we learn? What were the approaches that were impressively deployed during the COVID-19 pandemic, that these ancillary issues could actually begin to benefit from and enjoy. So that is an option that is available for you. Another thing that I think we should also you can talk about is the money. Money, generally, stories around money are always very, very good to tell, to also keep track of. So, money was coming in from all angles regarding during the packet phase of the COVID-19 pandemic. So something that you can do is actually look at you can keep track of the big money or even the small money, depending on how much access you have to data. A lot of pledges, a lot of announcements were made public. Some countries actually obtained loans during the COVID-19 pandemic. So you are never in short supply of money focused stories. Let me see if I can give you an example of um, of such. So the World Bank is a good place for you to actually get information around loans and loans obtained from the World Bank. So I'm trying to see if I can get some of these loans to for you to see, and I can demo it and show you. Okay, I think we are ready now. I think I'm ready. Yeah. So yeah, money is really, really good. So if you look at, let me share sorry, I'm sharing my screen now. a lot of loans were obtained. Some you can easily see, some you cannot easily see. But organizations like the World Bank under the project and project and financing page, project and operation page, you can actually see how much you can have insight regarding the money that countries borrowed from the organization. And interestingly, some countries are actually still borrowing still borrowing regarding COVID. So, for instance, in Senegal, what did you click? So, if you look at so let's say we are sorting them by their due dates approved. So there are a lot you can do with this. So Sao Tome and Principe, third additional finance so it's still secured, still had an update regarding its financing request from the World Bank to respond to COVID. So Senegal, second additional financing for the Senegal COVID-19 response project. So if you're a journalist interested in this, you can ask yourself, what is Senegal still borrowing money for? And this is something worth reporting. So you can, so the total amount borrowed, latest borrow is $15 million. So what they want to do with the money is to prevent, detect, and respond to the threats posed by COVID-19 and strengthen national system for public health preparedness in Senegal. So you can ask yourself a question that what is this project about? This is an insight to what you can be talking about. So the countries are still borrowing money for COVID-19 pandemic. So you can have insight regarding, you can do a really good story. A country like Morocco recently borrowed $350 million as a COVID-19 social protection emergency response. And so let's say we sort it out by the countries, the highest amount. So let's say we have, I'm trying to sort out the highest amount. So let's just say active. Let's look at active. So anyway, what I'm just trying to say is that you can actually still sort out countries by countries. You can sort out countries by countries, the ones that are borrowing the most, the ones that are not borrowing the most. India has 14 already COVID-linked financial agreements with the World Financial inquiries from the World Bank, whether they are approved or not. Pakistan has 12. So let's say I'm interested in what Nigeria has it. So let's say I'm interested in what Nigeria has been doing, what Nigeria's funding interest has been. So Nigeria initially borrowed 400 million. Then there is another 750 million, yet another 750. This is Nigeria's distribution sector recovery program. This is a 1.2 billion loan. So a journalist from Nigeria may be interested in why is a country borrowing so much from the World Bank, just from the World Bank alone, not to talk of other sources. So you can actually talk about money from the context of COVID-19 pandemic and bring attention, let the people know what what your country is borrowing money from. So there are lots of finance stories for you to write. Talking of pledges, talking of resources, what did your state government spend its money on? You don't have to know every details about all the money that was borrowed, all the money that they borrowed, but you only need to take a closer look at just one of these finance pledge, and that makes a really good story, tracking it from when it was pledged to how the money was executed. By the time you are looking at all of this data, you are going to have a lot of impressive stories to tell. So I really just want to encourage you uh, to not be, you will agree with me that there are lots of fascinating things that you can actually do vis-a-vis the COVID-19 pandemic. It has been a really, really rally moment for us to be able to actually see things working in real time. A lot of mistakes were made. People that would be very careful with something would have probably left some footprints that you can easily track. We now have more newer digital tools that you can use to actually follow up and track things, track transactions, follow transactions, connect the dots, make inferences. There are lots of experts that you can reach out to now. Organizations have policies in place that even when you're in country, even if you are trying to talk to your government officials and they are not willing to speak to you, places where they are borrowing this money from, they actually have information about these loans that they're actually obtaining. They have them all spread out on their website such that you can still write really good stories about them. So there's a lot that you can write regarding the COVID pandemic, and as you would have rightly seen, this is it's a chapter that has not ended. The disease is still right among us, and we still have a lot of stories to tell. And it doesn't have to be deaths alone. It doesn't have to be the number of cases alone. It doesn't have to be what is happening. It doesn't have to be what the public health authorities are saying regarding the disease. It only has to be something that is of relevance to your audience. I've seen a lot of really, really beautiful storytelling on social media, and even on even video stories that talked about how the COVID-19 pandemic shutdown actually affected economies. You know, your country's economy was also affected. How is your country building back? How are the business entrepreneurs whose businesses were directly impacted by the COVID-19? How are they building back? What is their, which ones are actually have fully recovered and which ones would never fully recover from this? So what is their experience? So take your audience through all of this, and you are going to have a lot of beautiful, beautiful, beautiful stories to tell. And I hope you've been able to gain one or more things from today's quick update on keeping up with COVID. And there are some things that I also want to talk to you about, which is the fact that if you are a journalist that has a media venture, I'm glad to announce that next week we are going to be having a very, very serious session that looks at media entrepreneurship. I would advise you not to miss that particular webinar because we are going to have, it's a partnership between this initiative and ICFJ's Elevate project. So the theme for next week's webinar, it will be on developing a robust revenue portfolio, making money in the new journalism ecosystem. And this webinar is highly recommended for individuals that have media businesses. If you're a media entrepreneur, if you have a media project that you are working on and you are struggling with one thing or the other in scaling or in actually achieving profitability, then I highly recommend this session for you. I'm going to put the link in the chat box right now so that you can actually be able to quickly register for that. The link is in the chat box. I encourage you to register for that and join us I'm not the one that is going to be leading that session. The session, we have a guest speaker that is coming to lead the session. Is very, very appropriate for this task. His name is Jeremy Kaplan, and by quick introduction, Jeremy is the Director of Teaching and Learning at CUNY's Newmark Graduate School of Journalism in New York, where he's teaching. He teach classes, workshops, and webinars on entrepreneurial and digital journalism. So please come and learn from Jeremy. Come and gain insights on how to actually and properly run a media entrepreneurship to profitability. And you're going to be gaining information around Elevate, which is ICFJ's project program to support media entrepreneurs across the world. So we are really glad about this partnership, and we are really happy that we can bring this information, insights, tools, and opportunities to journalists that are working on different projects. I believe very few journalists had classroom teaching on media entrepreneurship. A lot of media entrepreneurs, especially journalists on media entrepreneurs, often learn on the job, often have to figure out how things work and which things are not working. So this is why we are really, really glad that we are able to bring this opportunity to you. So I encourage you, if you are not a media entrepreneur, but you know a friend or colleague that is running a business, come and gain free information, free tools and guidances regarding how to properly and profitably scale up your media entrepreneurship. In a nutshell, I hope that this session has encouraged you not to give up on COVID. I hope it has encouraged you to go and take it has renewed your interest in covering this very, very key chapter in humanity, and that is still with us. COVID-19 pandemic is not over. The world is not free, has not gotten rid of the COVID. The virus is still scary, is still waxing stronger. New strains continue to be discovered. People are still dying from this disease. Hospitalization is still the issue. Testing and lots of gaps continue to exist. Vaccine access is still a major issue. In addition to policy guidances, it is still a major topic at the global conversations, and which is why you as an individual journalist, you should strive to continue to find creative ways to write about this pandemic. And in summary, two things that I actually highlighted is the need to look at these keep reporting COVID by, number one, latching on the now available opportunity to write long form stories that looked at critical, that peculiarly and uniquely looked at critical stages of the COVID response, both locally and internationally. And of course, to also look at what happened and the impact that this is having, how the world is moving on, how we are adjusting to these issues, and some of those specific case in point scenarios that I've already described. And I hope you are going to write really, really amazing stories. We're always happy to read amazing stories from you. If you've written a COVID-19 pandemic story in recent times and you would like to share with me, I'm more than happy to check them out, to read them, and to actually share with our audience. And if you are also in need of any additional assistance, any additional information, if you want me to signpost you to where you can get more resources on your COVID-19 pandemic storytelling, I'm always available. You can either send me an email, or you reach out to me via the ICFJ Pamela Howard Forum on Global Crisis Reporting. Is a very, very active Facebook group page, and you send me a message, and we are going to facilitate and get to the help or the assistance or the information, the tool, the resources that you need. And I hope that that is okay. To get more information about this forum, to get more information about this initiative, I encourage you to check out ICFJ's website on www.icfj.org. And I cannot over recommend I always recommend a platform that is resourceful for getting information, for getting resources, and to keep up to date about journalism opportunities, which is International Journalist Network. So please check out International Journalist Network website on www.ijnet.org. I expect that you're a member of our very active forum, but if you're not a member of that, I'm going to put the link of that forum in the chat box. But in addition, you can still, anytime if you miss that link, what you can always do is to go to Facebook and search for ICFJ Pamela Howard Forum on Global Crisis Reporting. I encourage you to continually report on health issues. There are several other health issues too that you should report on. And a closing tip that I have is to now not just be looking at individual health conditions, but actually be looking at where they overlap, look at the policy directions, look at the response strategies, look at the preparedness, look at the structures in place that are very, very important to having a vibrant, strong, and nascent health system. What has your country gained? What has your region done? And how are they keeping up to the enthusiasm, to the interest that were the hallmarks of the acute phase of the COVID-19 pandemic? In a lot of countries, in a lot of places, those drives had already been lost. Policies are no longer being aggressively promulgated, and where the policies exist, some countries are no longer actively following them. A lot of countries raised to talked about being able to produce COVID-19 vaccine. So what has happened to that plan? Lot of promises were made by NGOs, by international organizations regarding supporting countries, regarding local capacity development. So how has that evolved since then? Some are not talking about this again. Some of these processes that a lot of things that already happened and make them not to be top priorities again. But we as journalists, we cannot afford to quickly move on just like others. Our good stories, our ability to write incredible stories largely lies on our ability to take a step back and go and do some more research, take a closer look at what others are ignoring. And I hope you are going to continue to take a closer look at COVID so that you can write those beautiful, unique, highly impactful, but very, very relevant stories that would not just take you places, but would better tell the stories of what's happened during this COVID-19 pandemic, not just to the present generation, but for the generation unborn. We are record keepers. We are ones that will document this history of what is happening in this pandemic so that future generations, when future pandemics happen, the stories of this pandemic and how we were able to document them could actually be resourceful in how the world responds to the next pandemic. Thank you very much and enjoy the rest of your day.